Hi, my name is Rachel. I'm at McMaster University. I'm studying a Master's of Public Health right now. I did my undergraduate degree here at UTM. I studied neuroscience and philosophy, and I was really enjoying a lot of my psychology classes and the statistical aspect of them. And I also participated in a bunch of research here, so I knew I liked research as well. But I wanted to look for something on a bigger scale that could make an impact for a lot of people. So I did some research and I found that public health actually does research on a population level using lots of statistics, and that's how I discovered the field and decided to apply to a program. I looked into a lot of programs in Ontario, and I really liked McMaster because of their HEI program, their Health Research Methods, Evidence and Impact program. I really liked the different initiatives and topics they studied, and I also heard they're really good for health sciences. And their program was nicely set up where you could either do a thesis or a practicum, which is like an internship. And so I decided to go with that school and do their practicum option. So usually I'll wake up pretty early and go to class for about 3 hours, and then afterwards I'll work on group projects with some classmates, because there seems to be a lot of group work in my new program, which was a bit of a shift from me from undergrad, where it was mainly our own individual work. And we have classes about 3 to 4 days a week and 1 to 2 classes a day. So it's a pretty good balance. You have lots of time to study as well. I didn't know how involved public health was with politics, and I had never taken any courses in that field before or had too much personal knowledge, so I had to learn a lot about the municipal, provincial, and federal levels of the governments and how public health is really ingrained at each of these levels. A lot of people may say this no matter what field they're in, but definitely the friends I've made in my classes, it's really nice to be able to have support as you're going through your program, people who can really understand what you're going through because they're going through the same experiences, and working with people who will probably be your future colleagues one day. It's a really nice aspect of it. I wouldn't say any really big challenges, but definitely in my undergrad, I started off procrastinating a lot. It was just a personal bad habit. I remember I would do my projects I would submit them 5 minutes before they were due, and it was very stressful. So I worked on improving that and my time management a lot in my 3rd and 4th year. And I'm really glad I did, because now with my big workload in my master's, I never feel like I'm drowning in it or it's too much, because I've learned to set these boundaries with myself and do my work much ahead of time. Yeah, I really like epidemiology within public health. So that's the study of the spread or distribution of disease or health-related factors in a population, and then also studying evidence-based methods to prevent this spread or improve these health-related factors. So after I graduate, I hope I can become an epidemiologist, or I can at least start as a health data analyst, and then after a couple of years transition into epidemiology. I would say public health is a very broad field, so definitely do research into all the different areas within it so you discover what best suits your interests, and then from there, talk to someone who's in the field. That's the best way to learn what it's like on the job every day. And also Dr. Ronford gave me some really good advice when I was exploring this field, and he said to do an introductory course in whatever you're interested in to make sure that you actually enjoy the work and you get some first-hand experience. So myself, I did an introductory course in epidemiology. It was just on Coursera. It was offered by Johns Hopkins University. So I would recommend looking into something like that to make sure you're really interested in it before you commit to a whole program. Actually, my first internship starts in about a month. So I don't have any first-hand experience yet, but I think I'll be doing some epidemiology research with a professor as a practicum. And I think it's great to start to be able to apply the skills that you've learned in your classes, and also just start learning some of those soft skills that you'll have in the workforce before you finally graduate one day and start your job. I would say maybe some people don't fully understand the impact of public health because a lot of the work is done like very behind the scenes, or it's done at a very upstream level for preventative measures. So for example, just measuring surveillance to make sure no outbreaks occur in a community, or doing preventative programs, whether that's vaccinating the population or programs for the social determinants of health. And so these interventions may not be as visibly tangible as, say, like traditional medicine, but I would argue they're very important, or maybe just as important, because they've helped increase like the average lifespan of Canadians and others like all over the world, and they help keep our communities like very safe and healthy.